161. MI can cause papillary muscle rupture. True or false? Answer. True. Rationale. Papillary muscle rupture, a rare post-MI complication, causes acute mitral regurgitation and heart failure per AHA Complications. 162. The nurse should teach MI patients to avoid all physical activity post-discharge. True or false? Answer. False. Rationale. Supervised physical activity is encouraged post-MI to improve cardiovascular health per AHA Cardiac Rehabilitation Guidelines. 163. The nurse should monitor for hyperglycemia in diabetic MI patients. True or false? Answer. True. Rationale. Diabetic MI patients are prone to stress hyperglycemia, worsening outcomes, requiring tight glucose control per AHA Metabolic Guidelines. 164. MI pain is always severe in intensity. True or false? Answer. False. Rationale. MI pain varies in intensity from mild discomfort to severe, depending on the patient and infarct size, per AHA Clinical Manifestations. 165. The nurse should assess for S4 heart sound in MI patients. True or false? Answer. True. Rationale. An S4 heart sound may indicate reduced ventricular compliance post-MI, requiring assessment per AHA Clinical Evaluation. 166. All MI patients experience Q waves on ECG post-event. True or false? Answer. False. Rationale. Q waves develop in some, but not all, MI patients, depending on infarct size and location, per AHA ECG criteria. 167. The nurse should teach MI patients to maintain a healthy BMI. True or false? Answer. True. Rationale. A healthy BMI reduces MI recurrence risk by decreasing cardiovascular strain, per AHA Lifestyle Guidelines. 168. MI can be diagnosed solely based on patient symptoms. True or false? Answer. False. Rationale. MI diagnosis requires ECG changes, biomarkers, e.g., troponin, or imaging, not symptoms alone, per AHA diagnostic standards. 169. The nurse should monitor for atrial arrhythmias post-MI. True or false? Answer. True. Rationale. Atrial arrhythmias, like atrial fibrillation, can occur post-MI due to atrial stretch or ischemia, per AHA Complications. 170. The nurse should administer beta blockers to MI patients with uncontrolled hypertension. True or false? Answer. True. Rationale. Beta blockers help control hypertension and reduce myocardial oxygen demand in MI, unless contraindicated, per AHA Pharmacologic Guidelines. 171. MI can cause left bundle branch block on ECG. True or false? Answer. True. Rationale. Myocardial ischemia or necrosis can cause left bundle branch block, complicating MI diagnosis, per AHA ECG findings. 172. The nurse should teach MI patients to avoid NSAIDs post-MI. True or false? Answer. True. Rationale. NSAIDs increase MI and bleeding risks by affecting platelet function and blood pressure, per AHA Medication Guidelines. 173. The nurse should assess for syncope in MI patients. True or false? Answer. True. Rationale. Syncope may indicate arrhythmias or reduced cardiac output in MI, requiring assessment, per AHA Clinical Evaluation. 174. All MI patients require coronary artery bypass grafting, CABG. True or false? Answer. False. Rationale. CABG is indicated for specific MI patients, e.g., multivessel disease. Not all, with PCI or medical management often sufficient, per AHA Guidelines. 175. The nurse should monitor for signs of renal failure post-MI. True or false? Answer. True. Rationale. Cardiogenic shock or contrast dye from PCI can cause renal failure post-MI, requiring monitoring, per AHA Complications. 176. MI can be asymptomatic in diabetic patients. True or false? Answer. True. Rationale. Diabetic patients may have silent MI due to autonomic neuropathy, presenting without chest pain, per AHA Clinical Manifestations. 177. The nurse should teach MI patients to take clopidogrel with food. True or false? Answer. True rationale. Taking clopidogrel with food reduces gastrointestinal side effects, improving adherence, per AHA pharmacologic guidelines. 178. MI pain is always relieved within 5 minutes of nitroglycerin administration. True or false? Answer. False rationale. MI pain may persist despite nitroglycerin, unlike angina, indicating ongoing necrosis, per AHA clinical manifestations. 179. The nurse should assess for peripheral pulses in MI patients. True or false? Answer. True rationale. Weak peripheral pulses may indicate cardiogenic shock or reduced cardiac output in MI, requiring assessment, per AHA clinical evaluation. 180. The nurse should administer thrombolytics to MI patients with peptic ulcer disease. True or false? Answer. False rationale. Active peptic ulcer disease is a contraindication to thrombolytics due to bleeding risk, per AHA reperfusion contraindications. 181. MI can cause ventricular aneurysm formation. True or false? Answer. True rationale. Ventricular aneurysm, a weakened myocardial wall, can form post-MI, increasing heart failure risk, per AHA complications. 182. The nurse should teach MI patients to avoid all fats in their diet. True or false? Answer. False rationale. Healthy fats, e.g. omega-3s, are beneficial post-MI. Only saturated and trans fats should be limited, per AHA dietary guidelines. 183. The nurse should monitor for signs of stroke in MI patients on anticoagulants. True or false? Answer. True rationale. Anticoagulants like heparin increase stroke risk, e.g. hemorrhagic, requiring monitoring for neurological changes, per AHA anticoagulant guidelines. 184. MI can occur in patients with normal cholesterol levels. True or false? Answer. True rationale. MI can occur due to non-lipid factors like coronary spasm, thrombosis, or inflammation, even with normal cholesterol, per AHA pathophysiology. 185. The nurse should assess for fever post-MI. True or false? Answer. True rationale. Fever may indicate post-MI pericarditis or infection, requiring assessment, per AHA clinical evaluation. 186. All MI patients require lifelong ACE inhibitor therapy. True or false? Answer. False rationale. ACE inhibitors are recommended long-term for MI patients with reduced ejection fraction, not all, per AHA guidelines. 187. The nurse should teach MI patients to recognize signs of heart failure. True or false? Answer. True rationale. Recognizing heart failure symptoms, e.g., dyspnea, edema, ensures timely intervention post-MI, per AHA patient education guidelines. 188. MI can only be diagnosed with cardiac catheterization. True or false? Answer. False rationale. MI is diagnosed with ECG, biomarkers, and clinical symptoms. Catheterization confirms coronary occlusion but isn't required, per AHA diagnostic standards. 189. The nurse should monitor for signs of gastrointestinal bleeding in MI patients on aspirin. True or false? Answer. True rationale. Aspirin increases gastrointestinal bleeding risk, requiring monitoring for symptoms like melena, per AHA antiplatelet guidelines. 190. The nurse should administer nitroglycerin to MI patients with right ventricular infarction. True or false? Answer. False rationale. Nitroglycerin is contraindicated in right ventricular MI due to risk of severe hypotension from preload reduction, per AHA protocols. 191. MI can cause pericardial effusion as a complication. True or false? Answer. True rationale. Post-MI pericarditis or myocardial rupture can lead to pericardial effusion, requiring monitoring, per AHA complications. 192. The nurse should teach MI patients to avoid caffeine completely. True or false? Answer. False rationale. Moderate caffeine is generally safe post-MI. Excessive intake should be avoided to prevent tachycardia, per AHA dietary guidelines. 193. The nurse should assess for orthopnea in MI patients. True or false? Answer. True rationale. Orthopnea may indicate left ventricular failure or pulmonary edema post-MI, requiring assessment, per AHA clinical evaluation. 194. All MI patients experience ventricular arrhythmias post-event. True or false? Answer: false rationale. Ventricular arrhythmias are common but not universal post-MI, depending on infarct size and location, per AHA complications. 195. The nurse should teach MI patients to monitor their heart rate regularly. True or false? Answer: true rationale. Regular heart rate monitoring helps detect arrhythmias or exertional issues post-MI, per AHA patient education guidelines. 196. MI can be caused by severe anemia. True or false? Answer: true rationale. Severe anemia reduces oxygen delivery, causing demand ischemia and potentially MI, per AHA pathophysiology. 197. The nurse should monitor for signs of allergic reactions in MI patients on clopidogrel. True or false? Answer: true rationale. Clopidogrel can cause allergic reactions, requiring monitoring for rash or anaphylaxis, per AHA pharmacologic guidelines. 198. MI pain is always associated with physical exertion. True or false? Answer: false rationale. MI pain can occur at rest or with emotional stress, not only exertion, per AHA clinical manifestations. 199. The nurse should assess for paroxysmal nocturnal dyspnea in MI patients. True or false? Answer: true rationale. Paroxysmal nocturnal dyspnea may indicate heart failure post-MI, requiring assessment, per AHA clinical evaluation. 200. The nurse should teach MI patients to participate in cardiac rehabilitation programs. True or false? Answer: true rationale. Cardiac rehabilitation improves outcomes and reduces MI recurrence through exercise and education, per AHA rehabilitation guidelines.